One of the first tests that we're going to be doing is called the binocular vision assessment. And this test has 7 subtests within it. You or your child is going to be putting on these special red-blue glasses, red on the right and blue on the left. Each eye normally sees something different. And with this test, we're able to kind of separate the two, and it measures how each eye works and how the two of them work together as a team. Dr. Tiomno is going to demonstrate this, and we're going to go through each of the 7 tests that we're going to be doing. The first test is the Fourier, and what the Fourier means is where the two eyes want to position naturally in space. So the eye with the red lens sees the plus, and the eye with the blue lens sees the circle. And the task here is to superimpose the two. The next test that we're going to be doing is called Fusional ranges, and this is a measure of how the two eyes work together as a team. Here, the person is using the red-blue glasses, and within the center screen, there's a smaller square that's not visible in this video, but the person who's wearing the red-blue glasses will see a square up on top, bottom, right, or to the left. This first part with the red on the right and the blue on the left is a measure of how somebody is able to diverge their eyes or bring their eyes out. And the second part of this test, you can see the blue is on the right now and the red is on the left. And this is a measure of how we're able to bring our eyes in or converge our eyes. Once completed, here we're looking at the results of the top part. It tells us about divergence and how long somebody's able to do that. And the bottom two tells us about convergence or bringing our eyes in and how long somebody's able to do that. In the next part, what we're doing is called accommodative facility. And this is the physical ability to physically focus, kind of like when you're focusing a camera. This is a time test. You can see that there's a small C, and here what the patient has to be able to do is see where the opening of the C is. And what they're doing is they're using the arrow keys to designate if the opening is on top, bottom, to the right, or to the left. Once this test is completed, here we're looking at the results. These are the answers. So the top two tells us about somebody's ability to physically focus and relax their focus, kind of like what somebody does in class most of the time. And the bottom measure is how quickly somebody's able to transfer or switch between those two. The next test that we're going to be doing is called the saccade. What a saccade means is a jumping type of eye movement. Kind of like when we're reading, we not only look at the word, we then have to jump to the next word or phrase, and the next word or phrase, and when we get to the end of one line, we have to jump back to the beginning of the next line. So this measure, you can see where the arrows are pointing in different directions, tells us about that jumping eye movement. And once we're completed, then just like with the other tests, we're looking at the results. So the top part tells us about somebody's ability to do those saccades or that jumping eye movement. And the bottom bar tells us about how quickly somebody's able to do that. In the next part, we're doing the Worth 4 dot, and that's a measure of how we use our two eyes together and superimpose the two images. Here you can see that there are 4 dots. Somebody who uses both eyes together as a team will see all 4. Somebody who suppresses or turns off that other picture in their head may actually only see 3 or 2. And here, once we've completed, we can see the results of that test. The next test that we're going to be doing is called pursuits. And here you can see the E is moving in different positions. And this is kind of like how somebody tracks when reading. We have to be able to move our eyes efficiently across the page. And this is a measure of how we do that tracking eye movement. And again, once completed, we go back to this and we can see the outcomes or the results of this test. In the next test, called the Fixation disparity, this tells us about where the two eyes are pointing. You can see the red is on the bottom right and the blue is on the top left. What we're looking for here is, do the two align?